Hi, I'm Mackenzie Howard, and I am a licensed clinical mental health counselor associate, which basically just means that I'm a therapist here at the Purpose Center. I'm also a clinical assistant for some of the forensic evaluations that we do here, and I primarily do therapy with children and families, and I do have a smattering of adult clients that I see, but children and families are kind of my spot here at the Purpose Center.
And I'm Dr. Katrina Jones. I'm the owner of the Purpose Center and clinical and forensic psychologist. I do have a few kid clients right now. I've kind of moved away from seeing the youngins, but I do some family therapy and couples counseling and individual therapy and forensic evaluations, which I will let Dr. England talk about. But we also do some regular psych evals, which we'll talk about in a second.
Hi, I'm Dr. Samantha England. I am a licensed psychologist with a focus on clinical psychology and forensic psychology. My role here at the Purpose Center kind of do a wide variety. I do individual therapy primarily with adults. Also do some family therapy and some couples therapy work related to forensics. What I primarily do is forensic evaluations. What that basically means is we get a referral from maybe an attorney or sometimes Department of Social Services to do an evaluation, which we can dive into in just a minute.
What do you each do in your roles?
I'll go first. So in my role as a therapist, the particular work that I do is around with children and families. Oftentimes the reason why children are presenting to therapy is because of standard developmental things, so maybe like some impulse control, communication skills, learning how to advocate for themselves in a productive, healthy, and respectful way. Oftentimes we have kids whose parents are going through a divorce or separation, and that obviously impacts the children, and so a lot of times kids will come to help kind of process what that change is going to be like for them in that transition period. Also, we do some work around like coping skills, and really part of working with a child involves working with their parent or guardian to also help them to implement some practical tools, help the kids remember to practice the coping skills that we talk about, because oftentimes it's out the door as soon as they are. So I try really hard to have a collaborative approach and bring the parents in so they feel like they're involved in the work that we do, and they kind of have an idea of what type of work that we're doing with me and the child. So that way they can practice the things that we talk about when they're at home. With families, a lot of that is particularly around communication. Sometimes things would transition, like I said earlier, if someone's parents are getting divorced or separated, that can often impact the parent-child relationships in different ways. Sometimes people are court-ordered to be in family therapy, so we will do some work around whatever that particular concern is. It just kind of depends on the person, but my purpose in family therapy is to help the individuals there kind of redefine their relationship in a positive way and establish a new normal, so that way they can have a healthy dynamic that lasts long after they stopped working with me. And then in individual therapy, it could be a lot of different reasons why someone comes to individual therapy, but the primary things that I work with are things like anxiety, depression, having issues with like setting boundaries with the people in their lives, some work around adults with ADHD. We do some executive functioning skills work so that way they can kind of be more productive and help themselves in their lives moving forward. And my last role here is as a clinical assistant. That's the branch of the forensics that I'm involved in. And if you come to us for a forensic evaluation, typically myself or one of the other master's level clinicians will be one of the first people that you're interacting with. We do the intake paperwork, kind of help you to get your feet on the ground in terms of understanding what this process looks like, we'll do the clinical interview with you, and we'll also set up and administer your testing that you will do. Yeah.
And sometimes people will ask why there's more than one person involved with these evaluations. So initially when I set up this team approach, really it was so that I could have help, because these evaluations can be big. There's a lot of information to go through, a lot of different, sources of information and people you have to talk to, records you have to review, things like that. And once I had somebody helping with that, I really saw the value in having multiple ways of perspectives and things, ways to gather information and ways to think about these evaluations. So I set it up so that we would always have at least 2 people, sometimes 3 depending on the case, working on an evaluation, both forensic and clinical, because having a different mindset can really be useful as you're gathering information and making recommendations and diagnoses. So.
Absolutely. Yeah, and with the forensic evaluations, so like Dr. Katrina said, sometimes it's really helpful just to have like 2, maybe 3 perspectives, because as she mentioned, it is quite a bit of things to go through. So what I like to do in that role is kind of, explain the purpose, walk them through, maybe how long it takes, because you see a variety of forensic evaluations. Typically people find themselves, whether it be in like family law, personal injury, or on the criminal aspect, and themselves or their attorney is asking for a forensic evaluation, and that's kind of where we step in. So what that process looks like is we, as Mackenzie said, go for an intake, get some information, and then typically the person meets with a psychologist. And it's really just for us to meet with the person, gather some information, because the referral questions can look very different depending on why the person is coming in. But it's just a good way for us to get a good picture of what's going on and answer those questions that were being asked.
And I think a lot of times people will wonder why, because there is the forensic piece, why come here if you're not involved in the court system? And really it's because psychologists can help with diagnostic clarification. So are you having a substance use issue? Is that actually impacting your life? Or is it that somebody in your life is not happy with your substance use, but otherwise it's not really a problem, right? Being able to help you kind of sort through that. Diagnostic clarification can be helpful for, is there a bipolar diagnosis that would explain behavior? But it can also just not matter. Sometimes what really matters is that you have an understanding of what's happening with you, right? Maybe you have symptoms, maybe you don't, maybe it's a personality pattern, and that's causing you some strain in relationships or maybe some problems at work, and you just want to have a better sense of who you are as a person, which can be a really actually fun way to get to know yourself, do some introspective work. And then people can use that in individual therapy. I've also done it to help people understand each other. So using some tools to help look at your personality pattern and how you interact with your domestic partner can be really helpful and interesting information. So I will sometimes use that to help people in couples counseling. It can sometimes also be beneficial if people are going through discernment counseling, which is one of the things I do, helping people decide whether to separate or get divorced. And then if they do decide to stay together, they have that information that they can use in couples counseling. And then I think thinking along the lines of if they have decided to separate, some of the things that we can offer as well are co-parenting, either individual, we have a co-parenting workshop. We also can, again, kind of direct people towards how do you do this with some dignity and respect so that your kid can get into treatment if necessary. You can do an individual work. You can maybe do some anger management, which is something that Dr. England also does here. And we just do our best, since we do have a team, to find different ways to have as many people involved as is helpful without having too many